Hi class. So we are going to talk about social ecological model in this chapter. So we are actually moving on to last time we working on the epidemiological calculation, but we're gonna moving on to the next topic, which is health promotions. So social ecological models actually provide a framework for promoting health, like kind of many different health activity things or something like that, health interventions or something like that. So we are going to talk about social ecological model today. So let me share my screen. Yeah, we are going to talk about social ecological models. Okay. So health promotions. So the meaning of health promotion is the development of individual, group, institutional, and community strategy to improve the health knowledge, attitude, skills, and behaviors. So the health promotions is kind of our effort to create strategy to promote health knowledge and attitude, skills, and behavior as a whole. Like kind of we can develop strategy for individual or group or community or something like that. So the focus of health promotion is like kind of create the strategy to improve the health knowledge, attitude, skills, behaviors, or something like that, right? So there is a actually important assumption for these health promotions. So the assumption is actually very important to understand factor that affect health behavior or knowledge, attitude, this kind of thing. So in order to develop the strategy, it is really important for us to understand factor affecting health behavior. What kind of factors actually can affect our health behavior? For examples, parent lifestyle can influence children's health behavior, right? So parent lifestyle. And also we talk about in the chapter 1, the living environment in your community also affect your health behaviors, right? If you have an awesome community environment, you are the easily access to the environment like park, and then you can enjoy your workout, like kind of walking outside, like kind of things, right? Yeah. So this kind of environment, like kind of thing, also affect our health behavior. So social ecological models actually provide a framework to understand these factors that affect the health behaviors. So social ecological models allows us to understand the factors affecting health behavior. So as you can see here, there are multi-levels of factors. So actually there are 5 levels: individuals, interpersonals, organizationals, community, and public policy. These 5 different levels of factors actually affect our health behavior. Also, understanding these different levels of factors allows us to actually provide guidance for developing successful health promotion programs or strategy. So we might need to understand the factors at different levels, and then what kind of factors actually, how they affect or interact each other's affect these factors, right? Yeah. So let's talk about each level of factors, okay? Yeah, in the next code slide, okay? Yeah. So individual, interpersonal, social, institution, policy, community, yeah. So first levels, the individual intrapersonal level factors. So these individual factors indicate the individual characteristics that affect health behaviors. You probably can think, what would be the individual characteristics? Think about the what would be individual characteristics that affect health behavior. So individual characteristics might include attitude, motivations, confidence, knowledge, or behavior skills like kind of time management skills or like kind of and then organizational skills, like kind of things, right? Yeah. So these individual characteristics definitely affect our health behavior. Let's take an example of this. If you someone's have a positive attitude toward the working on exercise, on the other hand, someone's do not have a positive attitude toward the exercise. Which one's more likely to do exercise regularly? Yes, someone's actually have positive attitude toward the exercise, right? So that person's mind more likely to engage in exercise regularly. And also motivation. Someone's actually highly motivated to eat healthy food compared to other people's. And that someone probably more likely to engage in health eating habit compared to other people's, right? So like this, individual characteristics actually definitely affect our health behavior. So individual characteristics indicate intra-level or individual levels, okay? Yeah. And then the next levels of factor is interpersonal levels. So as you can see, the interpersonal meaning of interpersonal and then this photo. So interpersonals actually indicate the formal and informal social climate or social support or network and system surrounding an individuals. It is more like kind of a social support between peoples. So supportive behaviors can be provided by primary groups like family, friends, colleagues, teachers, especially family and friends. This is our very, very important, significant others to affect that health behavior. Definitely have family, family members very support the individual's health behavior. For examples, parents. Parents actually support children's health behavior by providing many health resources. Some family just to eat junk food. Probably kids, that child probably doesn't like to eat healthy food. But on the other hand, some families like to eat vegetables or healthy food. The kids actually can eat more vegetable healthy food than others. Also, family members are actually working out regularly. Probably they're gonna support their children or their other family to working on the exercise regularly. So these kind of support systems also affect our health behavior. So especially in children groups, this interpersonal level is one of the significant factors that affect these children's health behavior, right? So we are working on some exercise or like kind of articles, online assignment, or other extra credit opportunity. So they kind of deal with the importance of interpersonal levels in terms of children's health behavior later. Okay, yeah. And then the next levels, that affect our health behavior is the organizational levels. So this kind of an organization is a systematic collection of people on the common identity like school, workplace, like kind of things that indicate organizations. So organizations can create a healthy environment. So from now, we kind of talk about the environmental factors. So these schools can create the healthy environments. So NSU actually initiate the healthy campus things. So healthy campus actually encourages students to engage in exercise, engage in eating better food, healthy food, or something like that. So, like this, organizations affect healthy behavior by creating healthy environment for people. Also, as you can see, these photos, NSU, we had an awesome fitness centers. So students actually used this fitness center for free. So we have a good environment for working out, right? So these school environment, healthy environments allows students, NSU students to engage in health behaviors, exercise or something like that, right? So also some other companies like Google, Boeing, like kind of these companies has their own company restaurants. So restaurants actually provide a healthy food, like kind of thing. So they're like kind of workers in their companies actually always can access this eating, this healthy food, this kind of thing. So that's why organization levels, actually these schools, workplace, like kind of these organizations can create a healthy environment, and that affect our health behavior too. Okay, yeah. And then the next levels is a community and environmental levels, right? Yeah. So we already talked about this one in the chapter 1, right? Yeah. The community environment plays a huge role in individuals' health behavior in terms of equity and accessibility, allowing people to practice health behavior. So you guys actually had this one for the online assignment, right? How these community environment levels actually environments actually affect the achievement of the equity matters, right? So this environment, everyone's can access the health resources like park and others like walk like kind of a walk trails, like kind of thing. Everyone, regardless of gender, financial stature, social statures, they can access this public environment, and then they can practice their health behavior. So that means all peoples, regardless of their like kind of statures, have same opportunity to access the DC environment. This allows us to achieve these equity matters, right? Yeah. So that is the kind of community levels and environmental level. So different like kind of types of environment, like kind of constructor features, like kind of fitness facility, like kind of whole food market, diabetes prevention centers or something like that. How many construct features are accessible in a community, right? This kind of constructor features. So we actually working on the online assignment for this, right? So according to this study, people actually can access more diabetic prevention centers in these areas, lower diabetic prevalence, right? If people is actually hard to difficult to access the diabetes like kind of prevention center, there would be higher diabetes rate, right? Prevalence rate. So these studies are kind of same things that we talk about this, right? How many construct features are accessible in a community? So more accessible constructed features for health behavior, health resources is like kind of allows us to have better opportunity to engage in health behaviors, right? Definitely this kind of environment affect our health behavior, right? Yeah. And then structural features, it include the walking trails, sidewalk, and cycling paths, like kind of things, right? So how better are structured features in a community? So we actually talk about this one in the first lectures, first chapters, right? So compare this community with this community, yeah, definitely better environment communities actually provide people with more opportunity to engage in health behaviors, right? Yeah. So we actually talk about the importance of environment, right? Yeah. Okay. And then the last levels that affect our health behavior is actually policy, public policy. So public policy also play a role in individuals' health behavior in terms of equity and accessibility. It is kind of the same things that the environments actually plays for like kind of for the achievements of the equity matters. So public policies actually cover everyone, right? So affect everyone's behaviors, right? Yeah. So for example, health education requirement for K-12 students. So this policy, this law requires all students in K-12 schools have developed knowledge about health behaviors in the class. So these ones allows all students in K-12 schools have a same opportunity to develop health knowledges, right? Yeah. And also some other policies like registrations allows people with a disability and access to fitness and exercise facility, like kind of American Disability Act, the Rehabilitation Act, or something like that. Especially Americans Disability Act is actually require facility to have a wheelchair ramp. So you probably see this kind of wheelchair ramp in each buildings, especially health like kind of clinics or fitness centers, some other building. This is the kind of registrations that we need to construct. So this kind of wheelchair ramp for every buildings. So that allows people who use wheelchair can access the fitness centers and some other clinics, health clinic things or something. So this policy also allows all people regardless of their statures and have same opportunity to engage in health behavior things, right? Medicare and Medicaid Act also like kind of a public insurance system policy. This kind of thing also allows all peoples actually have the same opportunity to access to the healthcare service or something like that, right? Yeah. So far we talk about the social ecological models, and also we talk about the 5 different levels: individual levels, interpersonal level, organizational level, community level, and public policy levels. So these factors actually affect our health behaviors, right? So we categorize this factor into the different level, right? Individual, interpersonal, organizational, and community and policy, right? Yeah. So what is the key point from social ecological models? So here, health behavior change strategy should target multiple levels to be most effective. So we just understand that health behavior, our health behaviors are affected by many different levels, right? Yeah, individual level, interpersonal level. So that's why we need to target multi levels of factors, right? Yeah. Also, behavior change usually a combination of individual and environment policy level interventions. This is the important key of these social ecological models, right? So let me explain about this meaning of this combination of individual and environment and policy level. So that means we kind of help people increase their motivation or attitude or knowledge. But if we do not have a place, environment, or policy, they cannot practice their health behavior. So that's why a combination of individual and environment levels of factors intervention is very, very important. For examples, if you're living in rural areas, it is hard to access fitness centers, but you are highly motivated, but you want to have some kind of a fitness equipment for your exercise, but you need to drive for 40 minutes or 50 minutes to get to a fitness center. What is going to happen? Probably, yeah, if you are going to the fitness center and do exercise, but not regularly, it's kind of hard. But on the other hand, if you are highly motivated, but your neighborhood has a fitness facility, what is going to happen? You are more likely to do this fitness behavior almost every day, right? You can easily access this fitness center and you can easily have an opportunity to practice your health behavior. So that's why it is really important for us to develop strategy by combining these individual level and environmental levels, right? So that is the meanings, some key points from the social ecological models. And then I talk about this already. Community, environment, and policy would help people easily access the health resources, part like physical education policies. So the achievement of equity matter in public health, right? Yeah. So this is all about the social ecological model. So if you go to the Blackboard, you can have an extra credit assignment, and also you guys have a review questions and online assignment too. Okay, yeah, thank you.